Hello and welcome to another episode of the IBMS podcast. I'm Rob Dabrowski, the editor of the Biomedical Scientist magazine. And in this instalment, I'm joined by Craig Baker, the Biomedical Scientist of the Year 2025. Our discussion covers a range of areas, from implementing digital cellular pathology to managing teams across multiple disparate sites to leadership and promoting staff well-being. I hope you enjoy the episode. Okay, hello everyone, and today I'm joined by Craig Baker, the Biomedical Scientist of the Year 2025. Craig, thank you so much for joining, and could you give us a bit of introduction about yourself, how you got into the profession and what your route was?
Afternoon, Rob. Thanks very much for having me. It's a pleasure. So my route into the profession. So originally, I didn't intend to go to university. Having done my GCSEs and A levels, I always wanted to be a fireman. However, one of my close friends at school, his father was chief of fire in South Wales, and he advised against it due to not many jobs in the role at the moment at that time. So yeah, that sort of put a bit of a spanner in the works. So I ended up having to sort of regroup, rethink about what I enjoyed, what I liked, and I was always into the sort of the sports side of things and the medicine side of things and the biology side of things. So I did apply for sports medicine originally at the University of West of England, UWE Bristol. I was successful on getting on the sports medicine course. But like a lot of the sort of physiological courses, biology courses, first year you have people from all over joining the modules. So we had sports medicine, biomedical science, sports physiology, strength biology, some of the forensic sciences. So first year we all did sort of similar modules, and then it was at the end of that first year, one of the lecturers sort of pulled me to one side and said, "Well, have you considered converting to biomedical science, because you become professionally registered? There's a lot more job opportunity." So yeah, that's where I took the advice from one of the lecturers back in 2011, 2012, and never looked back, really.
Oh, nice. Well, the fire service and sports medicine's loss has been biomedical science gain. So it's
He's in the 6 days, isn't he?
yeah. And what happened after that? Kind of how did you then make your way into the profession from university?
So the course that I transitioned onto was a 4-year course with a placement year. So on the third year, I went out into industry, into placement. So I managed to secure myself a year's employment with Swansea Bay University Health Board. So come back to Wales to work in Wales. So I spent 12 months with them guys in Swansea Bay, learning everything that I needed to know about cellular pathology, because obviously the academic side is completely different to the practical side. So it was nice to actually put the theory and the education into practice, be part of a team. So yeah, I thoroughly enjoyed my 12 months there. Went back to university for my final year, and then luckily, on completion of my degree, a post opened up back with Swansea Bay, and I spent the last 10 years with the team in Swansea Bay, working my way up through from a registered BMS Band 5 up into specialist BMS. And it was at that point then I decided to go into management. I don't know whether that's a good thing or a bad thing, but it's got me to where I am today. So yeah, I wouldn't change anything that I did. And then in the last 2 years, I transitioned to Hywel University Health Board to take up the service lead post for cellular pathology and mortuary services.
And tell us about that current role, Craig. What do you do at the moment?
Say again, sorry, Rob.
Tell us about that current role and what you do at the moment.
So at the moment, I'm the service lead for cellular pathology and mortuary services here in Hywel. So I've been here for the last 2 years. Inherited quite a traditional service, very productive, very functional, but lacked the modernisation that we've seen of some services of late. So the last 2 years have primarily been focused around workforce model changes. We've really looked to implement surgery practitioners. We've got our BMSs working at top of license, and we're in the process of advertising for advanced practice dissection biomedical scientists. So we've really focused on modernising our workforce at the same time our work practices. So we've been really, really lucky in securing funding for digital pathology. So we've implemented that into the service. We're also part of a national project looking at AI. So that's really, really exciting, really innovative, and we've had some huge efficiencies and gains with that. So yeah, the last 2 years have been very, very busy, but we're making really big strides to modernising the service.
Great. And I'm assuming there's the reason why you were named Biomedical Scientist of the Year this year. I've never been to that award ceremony. Can you tell us a bit about it, Craig, and how it works, kind of how you get entered, whether you were surprised to win or whether you thought, I've got this in the bag all along? What was the whole process like?
So it was a bit of a shock, to be honest, Rod. So I received an email from the Advanced Healthcare Awards team to say they'd been nominated, which is a huge honour in itself. Never previously been nominated for an award. So yeah, on first thoughts, I thought, is this a hoax? Is this a colleague buying for me? So yeah, luckily I did respond and ended up having to go up to London for an interview with the panel. So I was shortlisted. I think there was 3 of us, I believe, that were shortlisted. Spent the day in London, had an interview with a panel, and then attended the award ceremony in London. Again, a really, really good evening. It was nice to meet some of our biomedical scientists and healthcare science colleagues from the various disciplines. Fantastic afternoon to be thoroughly enjoyed, and if I'm honest, it's a massive shock to win. Never really thought that I was in with a chance. Some really good competition, some really strong contenders, and yes, delighted, but shocked, a bit stunned when they called up my name, if I'm honest.
Yeah. Oh, well, congratulations, Craig. From never having been nominated for an award to winning Biomedical Scientist of the Year. That's a fair old leap. So congrats. But let's talk about some of the work that kind of led to that nomination and that was behind the award win. And you mentioned the implementation of digital cellular pathology, which is obviously a massive thing at the moment. Can you talk us through what's happened there?
Yeah, so we're part of a national project, a national piece of work to implement digital cellular pathology throughout Wales. I see majority of people within cell path and pathology wide when there is a workforce shortage with our consultant workforce. So this is part of the strategy to sort of be able to access consultants wherever they are within the UK and same worldwide. If there's a specialist opinion that is required, then you can access that with a click of a button. Same with regional working. If there's colleagues in a neighbouring health board that are part of a specialist team, like the All Wales Lymphoma panel, for example, rather than having to traditionally pack up the glass slides, send them by traditional mailing methods, we can now, again, with a click of a button, send histological images to these consultants. We can have an opinion, a second opinion, or a result same day, and that's had a huge impact on the turnaround times and patient outcomes. So yeah, it's been game changing for us, to be honest. As a health board, we are remote. We are a rural health board, so to be able to have this technology now at the tips of our fingers, to be able to get second opinions, to be able to send cases mid-MDT to be reported. So we've had a case where there's a possible case that it was either the patient got rolled over the following week, or if we could digitally scan the image and send it to the consultant in Condy Bay, then they would report it immediately for us. So then that patient now has had their treatment started 7 days quicker than they would have if we didn't have digital. So yeah, it's been game changing for us, to be fair. It's been fantastic. It's allowed us to work more closely with our All Wales Lymphoma panel, our All Wales Sarcoma panel, and again, allowed us to have second opinions, just a click of a button. So the efficiency gains and improvements in diagnostic care for our patients has been phenomenal.
Yeah, and turnaround times. I don't know if you'll know any of these statistics and kind of rough ballparks off the top of your head, but what kind of impact it had on turnaround times?
So for our lymphoma cases, for example, traditionally they were taking between 10 and 12 days. Obviously, the specimens will have to go through the lab as they do anyway. However, the unnecessary sort of delays of postage time, administration time, packaging things up, receipting them the other end, rebooking them in, it was adding enormous inefficiencies to the system. So transitioning to a digital platform now has allowed us to reduce turnaround times about 50%. So we put down from about 12 days to 6 days, which is phenomenal, to be fair, to be able to reduce those turnaround time for 50%. It's having a huge impact on patients. And we've been able to take you that step further then. So we're now staining immunohistochemistry slides for our colleagues on the Hywel informal panel. And again, being able to digitally scan those. So we have created initial panels of stains, which again, it's reduced turnaround time even further because we're not having to send blocks of tissue to the Hywel informal panel now for them to perform immunohistochemistry on, and we can do that in-house. So we're down to around about the 4-day mark now. But to go from 12 to 4 days is a pretty impressive feat. So it couldn't have been done without the team, man. I have to shout out the team. They've been phenomenal in embracing and implementing this technology.
Yeah, I mean, it's brilliant. And I suppose as well as, the quicker the patient is treated, the better. We all know about. But I guess it also has a big impact on patients' mental well-being, because once you've had this test, you just want the result as soon as possible, right? You don't want to be waiting for it.
Yeah, the waiting part is the worst part, isn't it? Not knowing whether something could be cancerous or not cancerous, and then the thought of having to wait 7 days, 10 days, even longer, perhaps in certain circumstances. It can't be nice for patients. I think if we were all in that position, we'd want an answer as quickly as we can, not just for our physical well-being, but like you said, for our mental well-being.
And you mentioned that it couldn't have been done without the team. Did you have to kind of manage the process very closely of the transition? Because often you'll find there'll always be certain elements of a team that don't want change, no matter what the change is. People always kind of push against it a little bit. Some people. Was there any of that, and did you have to use much of your kind of managerial skills on that, Craig, or was it everyone came in behind it, all smooth sailing?
It's like with all change, I guess. There's that initial fear. It's change. It's different. And CellPath as a service probably hasn't had a significant change for the last 50 years, if I'm honest. We're not like our colleagues in blood sciences where they've gone down the automated route. CellPath had been quite a hands-on traditional subspecialty for numerous years now. So the initial resistance, I say resistance, it wasn't really much of a resistance. The initial caution, I guess, was from our consultant colleagues, our medic colleagues, because they were all used to working from the glass slides. However, once we showed them the benefits, once we articulated the improvements in the pathways that we could implement, to be fair to them all, they were all really supportive, really engaged, and helped drive that implementation and change. Same from the laboratory team. They were fantastic. There's a significant number of team members that quite like the technology and the advancements, and particularly the AI side of things. We've got quite a young workforce here in Hywel, so it was more their bread and butter. So no, they were brilliant. There wasn't that much resistance at all, if I'm honest. As soon as we articulated the benefits and highlighted some good case studies, it was quite straightforward.
Oh, brilliant. That's good news. And while we're talking about change and resistance, let's quickly move on to AI, Craig. I mean, AI is amazing at pattern recognition. What are your thoughts on kind of the impact that AI can start to have and may have in the future, kind of on the back of digital cellular pathology?
So again, it's really exciting work being done in Wales, if I'm honest. Again, as part of the National Digital Cell Pathology Programme, we have implemented IBEX, artificial intelligence. So this started with just the scanning of our prostate core cases, but now we've increased that to breast core cases, and we're in the process of validating and verifying gastric cases as well. So it's been really exciting, if I'm honest. And we've seen some enormous benefits with it. The specificity and sensitivity of these AI algorithms has been game-changing. It's provided the consultants that confidence to report things much faster and quicker than they traditionally would have. Traditionally, they would have perhaps requested significant numbers of immunohistochemistry panels, whereas now, with the AI algorithms pointing out and highlighting potentially abnormal cells, it's given them that confidence to report cases far more quicker than they traditionally would have, perhaps. And the increase in sensitivity with the heat map that's now placed at the top of the histological section, it automatically highlights the areas of concern so that the consultant then can focus their eyes on the red sections rather than having to screen through the entire section as they traditionally would have and potentially missed one abnormal cell. It provided a lot more confidence in the consultant workforce. And again, a nice technology advancement for the laboratory to utilize as well.
Brilliant. So it's being used as kind of a way to speed up the consultant's work, to rather than having to look at the whole slide, it will just recognize certain patterns and be like, you need to look at this section now. Is that right?
Yes, yeah. I don't think that was the original intention to speed up work, but I think that's one of the benefits, the byproduct benefits that we've seen, is that consultants now have the confidence to report far more quickly than they used to, because they've got that sort of second pair of eyes reviewing the histological section, and they're not requiring as many immunohistochemistry panels as they would have previously.
So was the initial intention just kind of accuracy of diagnosis?
Yes, yeah. So Dr. Aslam in North Wales is a big advocate for AI and is leading the sort of charge for Wales. And he's shown us numerous case studies where he's missed cancer cells through first screening, and they've run the AI algorithm up the top, and it's just picked up minute changes that potentially would be missed, leaving the patient still with cancer.
So over previous years, with the kind of introduction of AI, into basically every single section of life, pretty much, there's always been some kind of reticence from certain people. And much as we're talking about when you change to digital cellular pathology, there'll be some caution. And with AI, there are obviously going to be those people who are concerned about their jobs and who say, this is actually technology that's taking part of my work. I mean, if you were kind of having a chat with one of those people now, what would you say, Craig, to kind of reassure them of the role that AI can play in a positive way as opposed to being a negative effect on the workforce?
And I think, to be honest, and to be brutally honest, I think that was concern from some of our consultant colleagues at the start. But this tool isn't to replace. These are AI tools to help enhance and assist. They're not a tool or a technology to replace our consultants or our consultant biomedical scientists. This is just purely a tool to help and assist with the increased accuracy of diagnostics. So I don't think there's a fear to be had at the moment. It's not being utilized as a tool to replace. It's purely an assistance tool to increase the accuracy of diagnostics.
How long do you think it could be until we've got this rolled out across the board? I mean, you said this is kind of trial work that's going on in Wales at the moment. When does that trial come to an end? When does it report? And, could we be looking at 5 years? Everywhere's having digital cellular pathology with kind of AI involved? Or is it kind of a longer term thing than that, a shorter term thing?
So we're already live. So as a national project, we're already live with the prostate cases. So that's routine now. That's normal. We scan every single prostate case that comes through the service. We've recently, within the last 12 months, increased that to breast core tissue as well. So breast core cases. So that's now live as well. So that's 2 massive tumor sites that are live across Wales. So now we're just implementing and validating the gastric tissue algorithm. So to be honest, it's whatever the IBEX and the AI companies can provide us with, because we've heard also there's potential algorithms that will screen every single case that comes through the laboratory. So we might have a case that might be marked as routine via GP, for example. However, once that case has been run through the AI algorithm, it might be something that is a little bit more sinister than we initially thought. We can then manage our workloads, allocate our work based on that initial screening, to prevent any query routine cases being treated not being treated in the appropriate manner.
Yeah. Brilliant. Well, it sounds like there's some real positive impacts going on that. And some of the other work that you won the award for, Craig, I know you've been quite active in raising the profile of the profession. How have you gone about doing that?
So I think healthcare sciences and particularly biomedical scientists are an essential role to deliver an effective and efficient healthcare. We're involved in around 95% of all clinical pathways now, which when you step back and think of it, that's an enormous amount of work. And rightly or wrongly, we've never been given the recognition or the profile as our medical and nursing colleagues. So I think public perception is they don't really know much about us. And the impact that we have on their care, their treatment, and their diagnostics. So it's a huge profession of huge importance, and we need to sort of get ourselves out there a little bit more and get that public recognition, even recognition within health boards. I don't honestly believe that some of our medical colleagues quite know what happens within the lab, because it's not just the lab. We've got multiple sub professions within pathology. So it's just raising our awareness, raising that appreciation, and highlighting the huge impact we have on patient care and patient outcomes. Without pathology, without healthcare science, we wouldn't have the brilliant patient care, patient outcomes, and healthcare system that we have.
Yeah. And how do you go about doing that, Craig? I mean, there's stuff like Biomedical Science Day we've just had the other day. Do you use special days like that? Do you and kind of, is there a way of interacting with other colleagues within the kind of healthcare system to raise awareness around that? Is there anything specific that you do then?
So we've been really active over the last couple of years, if I'm honest. We've recently had the Health Care Science Conference Cymru in Llandudno, a 2-day conference highlighting all of the fantastic work, all the innovation, all of the research that's going on within the healthcare science community. So that was a fantastic event, huge participation, big attendance of lots of different backgrounds, medical, nursing, research, healthcare science. So yeah, that was a really good couple of days there.
Were you involved in organising that? Is that right, Craig?
So that was our own in-house healthcare science conference. That was, so we've had our inaugural healthcare science conference here in Hull. So yeah, myself and Catherine led on the establishment of that, which again was a brilliant day. We had speakers from a variety of disciplines highlighting a day in the life of some of our lesser known healthcare science professions. We had brilliant attendance from our medical colleagues, our nursing colleagues. We were able to highlight and demonstrate some of the brilliant research and innovation that's going on in our in-house TriTech Institute. So yeah, it was a fantastic afternoon where we get to sort of showcase the best of healthcare science, the best of biomedical science, and get our profile raised within the health board.
Yeah, a great thing to do, because previously biomedical science has always been seen as behind these closed doors and working in these kind of narrow trenches, and a lot of the kind of progress we're hearing about at the moment is kind of knocking through those silos, multidisciplinary working. So it sounds like that's a really good day to kind of encourage that type of working and show everyone what you can do.
It was brilliant, yeah. And like you just mentioned, Rob, the Biomedical Scientist Day that we just had on the 5th of June, that was another brilliant opportunity. So we opened our doors up, where we were offering tours of the laboratories. So again, we had a really good attendance, really good participation. There were a lot of our medical and nursing colleagues coming to see what we do and the impact that we have on healthcare provision.
Oh, fantastic. And let's move on to one of the other things you obviously won the award for was your management. Talk us through that transition from, first of all, from being a biomedical scientist to going into managing people. Was that a tricky transition? Is that something that's quite natural for you?
It was a tricky transition, if I'm honest. So you go from being part of the team and one of them to being seen as perhaps somebody on the other side of the fence. So yeah, I can't lie. It was initially a tricky transition, particularly having gone through the system within Swansea Bay. So I started as a band 5, worked my way up into a specialist BMS post, and then transitioning into a management role quite early and quite young in my career. So it was quite a challenging transition, very exciting one at the same time. Being able to implement and have an impact on the team, professional development, personal development, implementation of change and technology. So yeah, despite it being quite tricky to manage people initially, I think it was massively rewarding at the same time.
What's your management style like, Craig? You don't strike me as a hardline disciplinarian. You seem very open to ideas and like you'd be a kind of a very flexible, kind of proactive manager. How do you have you got a philosophy behind your management? Or?
I think as managers and leaders, we're only as strong as our team. So that's a big philosophy and thought process of mine. A team can make and break us as leaders. So I'm quite an open and honest and compassionate leader. I like to empower my teams. I like them to own the change. Because if I'm trying to enforce change, there's always going to be that reluctance and resistance. However, if we get our teams involved from the onset, from the get-go, let them drive that change, let them implement that change, with just a little bit of steering from myself, then that they own that change, then it comes into the serious part more naturally, and is that far significant more buy-in than if it's just mandated and enforced. It's more likely to fail. So it's proven successful. We've had huge amount of change within Hywel Self-Path Service within the last 18 months to 2 years. Often change is scary, isn't it? Particularly if certain members of staff or teams have worked a certain way for a certain amount of time, but being open and transparent from the start and empowering the teams to implement and drive that change, it's worked. It's proven to be successful. So long way to continue.
And where did you get that from, Craig? Was that had you seen previous managers who worked in that style and you appreciated being managed in a certain way? Or is it something where you came in and you thought, I would like to change things, this is going to be my philosophy?
I think a bit of both, if I'm honest, Rob. There's been some leaders in the past where I thought, I quite like this style. Not just within healthcare. There's other leaders within sporting fashions and themes. If you think of Hywel Jones, for example, the ex-captain of Wales, he wasn't one to be barking and shouting and screaming at people. He sort of led from the front, led by example, and then people followed him. So yeah, I think I've taken sort of inspiration from a variety of people from a variety of backgrounds and professions, sort of try to merge them together into the way I lead.
Oh, okay. It's really nice that your kind of sphere of influences, getting back to your kind of medical kind of the early days at university. It's nice to see that medical sports thing coming through as well, and bringing in influences from different areas is always a really interesting, positive thing, I think. And you manage people over multiple sites, don't you? Is that correct?
Yeah, so within Hywel we have an enormous geography, all the way from down in Pembrokeshire, West Wales, up to Aberystwyth up in the north. So we've got about an 80-mile geography between those two sites. About 2.5-hour drive. So yeah, we've got 4 really remote geographically challenging locations. So it is unique, and it does provide certain challenges that other organizations perhaps wouldn't have to consider. For example, the more city-based organizations. So yeah, it can be challenging, and there are certain things we've had to implement to mitigate those challenges. But yes, it's not easy.
How do you cope with that? Do you go and visit the different areas, or are you just based in one and everything is kind of remote through Teams? How does it work?
So for our Cellular Pathology service, we are centrally located in Gangwylly Hospital. But for our mortuary services, we do have a stat presence and a mortuary presence on all 4 of our acute sites. So as I alluded to earlier, team is a massive ethos of mine. Team, we have to be part of the team. We have to feel part of the team. So we do have daily and weekly Teams meetings, but we are active as a management team in making sure that we do physically attend our sites and visit our teams. We do try and organise and coordinate some away days and training days as well, where all of our team members get to meet up and see each other in person. So that's a big piece of work that we're trying to undertake, and a big thing that we consider. We are geographically remote, and we don't want people to feel isolated. So yeah, we do work quite actively and hard to make sure that everybody does feel part of the team.
Well, were you working in a management role across kind of this kind of disparate area before COVID, or have you just been in that role just after COVID? I'm just curious as to whether how much things changed in the kind of post-COVID period where using Teams and stuff like that is a lot more, it's a lot more normal.
Yeah, so I've been in a role previous to COVID, and like you said, it was different. We did attend in-person meetings far more frequently. Teams wasn't such a big thing prior to COVID, and I guess it's a bit of a blessing and a curse, isn't it? We can now have easy access to people. We can dial people up pretty much on the spot. We don't have to attend physical meetings, but then also makes us very accessible as well. So it's a bit of a double-edged sword. Teams, it comes with its benefits, but then it also comes with its cons as well, if I'm honest.
Yeah, quite a few people I know who work in management. When you look at their diaries, it's just meeting all day long, with perhaps meetings that wouldn't have previously existed, because it would just be a case of you would see someone on site and a 2-minute chat would sort something that's not needed. I mean, is a lot of your time taken up with meetings, Craig?
If I'm honest, yes, but we are quite active in our diary management. If we can meet with people in person, we'll choose to do that. Particularly when it's on site, there's not really an excuse for having a Teams meeting if we're on site and our colleagues on site. We do try and get as much face-to-face interaction as possible, particularly as we talked about earlier, implementing any change. I think it's far more personal, and people really buy into it far more when you can articulate the change or the technology or the improvement or the innovation that we want to try and achieve. It's far easier to do that in person. We can have that dialogue back and forth, rather than the awkwardness of Teams sometimes where people are waiting with their hands. That it's far easier to speak to people in person.
Yeah, brilliant. And talk to me about the mortuary overhaul. So I know that was mentioned in the AHA award. What's happened there?
So yeah, again, we've inherited a very traditional mortuary service. It was functional, really functional. They seem to deliver in exactly what they need to deliver. But again, we've tried to come in, and over the last few years, really take it to the next level. We've had significant capital investment to improve security access systems. We've now got state-of-the-art system in all 4 of our sites. Same with our CCTV. Again, got the real state-of-the-art network CCTV system. So that allowed us to audit anybody who is coming in and out of the mortuary far better than we were able to previously. Same with the equipment. We've had a significant investment in our hoists, our ceiling hoists, along with our mortuary trolleys. But probably the most important piece of work that we've been doing is the mortuary viewing facility upgrades. As I alluded to earlier, we've got 4 really remote sites, and we need to ensure that we are getting equitable experiences for all of our families. So if you're visiting one of your loved ones within our mortuary, it's probably one of the worst times of your lives. So we need to make sure that experience is good for everybody, or the best it can be. Prior to joining Hywel, there was a new build in the mortuary in Glynwilly. So it's got a fantastic viewing facility, and unfortunately the other 3 sites weren't up to the same standards. So we've worked really, really hard over the last 2 years to get funding to commence that piece of work. So that's ongoing now. So once that's complete, we will have 4 mortuary viewing facilities that will provide the same quality of experience to the families when they come to utilise our services.
Oh, it's really important. That's great work. And people listening might think that there's been so much change over such a short amount of time for you here. We're talking about upgrades to cellular pathology and this kind of mortuary overhaul. How's the funding for this happened, Craig? Has it been one where you've had to proactively go out there and seek funding from different pots, or is it something where stuff was in place and it was due to happen anyway? Well, for people who think I'd like this kind of change at my trust, how did that happen?
It's been a challenge, but it's been one that's been made far more easier by our brilliant executive team here in Hywel. The way we've been able to present and articulate our ideas and plans and challenges, and have an executive board that are really bought into this improvement. They've seen what we've tried to do as a service. They've sort of bought into it. They've really jumped on the bandwagon as such and really supported us. So our director of finance really helped and assisted with the digital cell path business case, and then has helped us get that through public board. Our executive director of RE Health Professionals and Health Science and our deputy director of Health Science have been really supportive in the mortuary overhaul. So they've seen the big ideas we've had at the service. They've seen the improvements that it can have on patient care, patient outcomes. So they've really supported and championed us as a service and as a team, which is come to fruition with the support with the funding. So yeah, to go from where we were to where we are now in such a short period of time, it's been challenging, but it's been rewarding, and we wouldn't have been able to do it without our fantastic teams and the brilliant executive team we've got here now.
Brilliant. Yeah, it sounds like you're someone who's really good at working across barriers, Craig, and kind of working with different people to get the kind of the outcomes that are needed, which I think is fantastic. What do you think might be next? Is it? I mean, there's never any kind of finality in your world, but are there any further kind of changes in the pipeline, or for the moment is it just kind of bed in all the technology, make sure everything's functioning perfectly, and just kind of carry on?
So from a service point of view, we're trying to grow the service. We're trying to grow our workforce. We're trying to provide development opportunities. So as we talked a little bit earlier, we're exploring the advanced practice biomedical scientist route with the dissection. And we're also then pursuing consultant biomedical scientist reporting. So that's really exciting. So that's going to have huge impact on our service delivery. So we're pursuing that quite hard. We're also in the process of being part of a regionalised cellular pathology program and project. So we're working across health board boundaries. So how are working with our colleagues in Swansea Bay to see if we can build a new cellular pathology laboratory, which would be state of the art, have all the modern equipment, so it'd give us that space to grow and implement our plans, our workforce, and take our services to the next level. It's exciting times.
Oh, definitely. And what advice would you give to anyone listening who is kind of working in a similar managerial role and is looking to drive forward change? It sounds like something you're incredibly good at. What advice would you give to those people, Craig?
So my advice is be open to change, and collaborate. So there's people out there that have done things previously who have done something similar. So listen and take on advice. Collaborate with people from outside of our professions as well. So we have real strong relationships and connections within our healthcare science family here in Hywel. So there might be something within radiology or clinical engineering that could be really appropriate and a good improvement for cellular pathology. So I would be open, collaborate, and innovate as much as we can.
That seems like the perfect moment to come to a close. Craig Baker, Biomedical Scientist of the Year 2025. Thank you so much for taking the time to join us today. It's really appreciated.
Cheers, Rob. It's a pleasure. Thank you very much.
Thanks to Craig for taking part in this episode, and thank you so much for listening. I hope you enjoyed the podcast, and remember that this episode can be used as reflective learning for your CPD. Please do keep an eye on the IBMS social media feeds and website for future episodes. Thanks again for listening, and see you again soon.